If you're thinking about getting involved and maybe you read some books that are outdated or you talk to some older dentists or older folks, it's not what you think it is. The DSOs are, if the whole industry is evolving towards DSOs, and that's an enormous amount of opportunities for dentists and non-dentists. I mean, if you are a non-dentist and you've got a really sharp mind, and maybe under the old model, you might be an office manager. That's the best you're going to do is, they work for, say I'm working for Dr. Under the DSO world that we live in now, there are tons of management positions, regional, vice presidents, regional managers, directors over them, folks that work in the whole home office. So if you show up, even as a non-dentist, and you're really a good business person and you understand the business of dentistry, there are hundreds and hundreds of positions that have advancement that, are highly compensated positions. They'll give you stock in the organization. I mean, it's just, there's so many opportunities right now that wouldn't have been there in the traditional dental model, just the owner associate model, the traditional, you got an owner, maybe there's an associate, it's a solo practice. There's not a lot of opportunities there. Here, there's a whole world of opportunities for dentists too.
Yeah.
You can hold a bunch of positions. It's not just, hey, I'm an associate here and I'm just, practicing dentistry. You can be a clinical director. You can be, a hygiene director. You can be, a liaison between the DSO and the practices. You can be a trainer. You can teach seminars and courses like you and I do. I mean, there are just so many opportunities right now in dentistry that were not there even 10 or 12 years ago.